Welcome back. The holiday season is here, but it also means we are in the thick of flu season. And right now there is a new strain going around called H3N2 Subclade K, and it is making people sick. Joining us now is Dr. Philip Lamptey, Medical Director of Memorial Hermann's Go Health Urgent Care. Dr. Lamptey, thanks for waking up early with us. So
Good morning.
what is this new strain and how is it different from flu strains that we may more typically see?
So this strain is one that is a little different from the usual strain that we expect to see during the season or anticipated to see. It is still a flu virus, so the presentation clinically for patients will be the same. Currently, it's circulating in Canada, and they've seen it in UK and Japan as well. So with a lot of travel, we expect that to be here soon. But it is not clinically different from the ones that we see. It is such that our immune systems may not recognize it very quickly because that is not the usual strain that people get through the vaccinations and also in previous years.
Oh, so if you've had the flu shot like I have, will it be protective then against this particular strain?
It still gives you some protection, but given that the virus is a strain that is deviated significantly from what the anticipated strain will be, it takes a little bit of time for the body's immune system to recognize and fight it appropriately.
Okay, so a little bit like a half step off or something. Is the strain
Kind of.
yeah, is the strain considered more contagious than perhaps what was anticipated for this year?
Well, currently, I would say that we haven't seen it here in Texas, and I think in most parts of the US, we haven't really seen it yet. So whether it's more contagious or not is something that we would have to wait and see if the strain gets to our communities or not, and that would give us a fairly good idea about how contagious it is.
Are the symptoms similar then to the more typical strains?
Yes, the symptoms are similar to the same strains, and you would start off very abruptly, high fever, chills, runny nose, cough, body aches, and headaches. So those are mainly the things that you would see with the typical flu strain. And what is important is that with flu, if you get in the to see your healthcare provider early and they start you on Tamiflu, typically within the first 48 hours, you get some reduction in the duration of symptoms of the disease, so you can get back to your healthy state in relatively quicker. If you are seen after 72 hours, typically, then you don't get the benefit of Tamiflu.
All right, so respond quickly. Like other typical flu strains, the young, the elderly, the compromised, the most vulnerable groups?
Yes, they are the ones who are the high risk groups. So those ones are important. Vaccination is still very important, even though we have potentially a new strain coming to our shores. It's still very important to get vaccinated. And Memorial Hermann and Go Health has several urgent cares across the city, some of them open till midnight. So if you don't feel well, there is access that is extended into late into the day that you could still be seen in a timely way so we can get you treated.
Yeah, because sometimes you just can't schedule getting sick between 9 and 5.
Yes.
Any smart things we should do just to help us get a little bit of edge here to try and, not get sick, not catch the flu?
I would say primarily vaccination is still a good idea at this time of the year that will protect you throughout the season. Um, The other part also is respiratory etiquette, just staying home if you're sick, staying home from school, avoiding places where people congregate, making sure that you're covering your cough. Hand hygiene is very important as well. And those are the things that would help protect you, your family members, and your community as well.
All right. Thank you very much, Dr. Lamptey. We appreciate those tips, those good reminders. We appreciate it. Thanks.